Hello and welcome to Political Common Sense for America. I'm Brian Boeheim, the political engineer. And in this 3-minute video, we want to talk about healthcare reform. Now, one of the things you need to understand is that the politicians have really muddied the water around the whole issue around healthcare. See, there are really two issues here, and we're going to deal with them in separate videos to follow. The first one is that there's health care reform needed. Remember, health care is the providing of health care, both preventative and for services that fix you after you're broken. On the other hand, there is health insurance reform. And health insurance reform is needed to deal with issues like pre-existing conditions and limits on the amount of care that you will get and be provided by an insurance policy. They are two separate issues. But see, the politicians want to slap them together and mix them all up and try to boil the ocean. And that's how they're justifying a 2,000-page, 20-pound document that supposedly solves all the problems of the universe. And the reality is that it actually mixes it up and makes it more complicated. Because if you really look at the simplicity of it, health care is about finding methods of diagnostic prevention that find illnesses and issues faster and sooner so they can be treated easily and less expensively. On the other hand, health insurance reform is about finding the most effective way of insuring everyone in the country so that that catastrophic event doesn't put you out of business, does not rob and steal not just your life, but your income and your financial stability. So those are the two issues that we're going to deal with in the following videos. The reality, though, is any politician who is mixing and blending those together and confusing them is just trying to take you for a ride, and you should be very suspicious and ask more questions. Watch our other two videos on healthcare reform and health insurance reform for some ideas on how to solve those.